Integrative medicine is a blend of traditional and non-traditional medicine.
Integrative medicine is often called a movement, trying to restore the focus on health and healing, embracing the belief that mind, body, and soul work together to create a healthy living. Welcome to Health Matters. I'm Kristen Johnson. Today I'm digging deeper into the practice of integrative medicine. The term integrative can often be lumped into the category with alternative or contemporary medicine. But to be clear, the people you are about to hear from tell me their purpose is not to discount traditional medicine, but simply bridge the gap between what people generally think of as conventional medicine, like going to the doctor for a prescription, and what is considered non-traditional options, like acupuncture or massage. To begin, let's meet Dr. Andrew Weil, often called the guru of integrative medicine, and many centers base their practices around his philosophy.
I did not invent the term integrative medicine, but I think I'm certainly the person who has mainly popularized it, and I'm not sure where I first heard it. But I think wherever I did, it seemed to me that that was the right term, because in those days everyone was talking about alternative medicine, complementary medicine, holistic medicine. None of those felt right to me. You know, they all either pushed people's buttons or had a narrow focus or the wrong connotation. And integrative medicine seemed neutral and inclusive, and it's what I began to call the system that I practice.
Dr. Weil has become internationally known for his views on healthy living and his critique of the future of medicine and healthcare. He is an author and speaker, as well as founder and director of the Arizona Center for Integrative Medicine at the University of Arizona Health Sciences Center. He reteaches doctors to look at the body in a more holistic way.
Autonomic nervous system.
In a 2009 op-ed piece in the Wall Street Journal, co-authored by Weil, the doctor stated alternative medicine had become mainstream. A study by the Bravewell Collaborative, a philanthropic organization that works to improve healthcare, also notes, quote, over the past 2 decades, there has been documented growth in the number of clinical centers providing integrative medicine, the number of medical schools teaching integrative strategies, the number of researchers studying integrative interventions, and the number of patients seeking integrative care. Helen Grunow is one of those patients. She has cervical stenosis, a compression of the spinal cord. It causes her pain in her neck, and for many years, she was told she would need surgery.
I learned many years ago that I preferred alternative medicine. When you've had some bad experiences, then you start leaning toward other things. And I think, you know, something happened to me several years ago, and I wound up having acupuncture. And so, you know, that led me to say, you know, there's something else out there. And so for me, I prefer someone who looks at me in a more holistic way. Finding this, you know, has been a lifesaver. I don't like the one patch fits all or the one pill fits all, because that to me is a Band-Aid.
Grunow says she is feeling better already, and the goal is to get to a point where she does not need treatment on a regular basis. Dr. Babak Mukhari, an osteopathic physician at the Center for the Healing Arts in Charlotte, treats Grunow. He says oftentimes people with chronic conditions seek them out because they've exhausted other avenues in the traditional medical world. Osteopathic physicians, Dr. Mukhari feels, are often better at being open-minded to the integrative world. Here, he brings his training in the traditional medical field and blends it with non-traditional modalities that have, for the most part, been tested and studied and have been shown to help patients.
From the actual hands-on modality aspect of it, we are trained in a whole range of modalities that really look much more at the muscles, the soft tissue, the connective tissue, the ligaments, really looking at all of that instead of just the bones and the spine as a way of treating the patient's condition. So whether it's classically something like back pain, if they're coming in, we're looking much more at the muscles and is there any imbalance that might exist. Oftentimes with chronic conditions, really the more gentle approach and really looking at the muscles and how they kind of play into the whole thing tends to be much more effective. And as a part of that, I also will give my patients exercises and stretches to do, and also certain postures and positions to avoid, whether it's as a part of their exercise routine. That's really unique to their particular problem. So the goal is ultimately that they'll see me for hopefully just a handful of sessions, and they will improve to a point and have the information and the exercises and things to do that they can essentially maintain their wellness. Just like the prescription pad, it's a tool for me to help patients, and maybe not everyone's a candidate for it, just like when you consider a prescription, but it's another tool in my tool belt, so to speak.
Dr. Mokari established Center for the Healing Arts along with Carol Bondi and Laura Moriello. Not unlike Helen Grunow, Bondi found herself seeking something different after a neck injury.
I had great recommendations from physicians. None of them were ones that I was going to follow on any routine basis. I don't like to take medication. I was recommended to have a surgery that I also didn't, wasn't bad enough for me to think that I'm ready for a surgery. Although I'm not knocking surgery, that just wasn't for me at the time. And so I went down an alternative path and really found that it made a huge difference in my life.
I've known Carol since 1997. However, we had no idea we shared an interest in integrative medicine until probably 2 years ago. I've been a nurse. I've been traditionally trained. I've worked in the hospitals. I've sold pharmaceuticals. I did home care for a while. Always a little misaligned in nursing. Felt like there was something we were missing, something we were not able to give to our patients that I felt like I wanted to. So I went back and got a health coaching certificate because I felt like education is really key, and I think that people are hungry for ways to feel better, eat better, know about themselves. I think if given the opportunity, they can learn and really feel good about themselves.
I think words that are out there now, well-being and balance and feeling centered, are more mainstream now than they've ever been. I think corporations are really insisting on wellness packages for their employees. I think it helps reduce the overall cost of healthcare. Spending
the time to really connect with a patient, to talk to them, to reach that deeper level of understanding of what is their belief system, what are their barriers to their healthcare. So I can prescribe a pill for you to say, here, we'll take this for your diabetes, and I'll see you back in 3 months. And then wonder why when they come back in 3 months that they're still having problems or they're not reaching the goals that you wanted for them to achieve. And then we just label those patients as non-compliant.
A Harvard Science review released earlier this year noted 38% of adults and 12% of children in the U.S. use some form of complementary and alternative medicine. And according to a 2001 national survey, around 70% of patients never tell their physician what they're doing alternatively. 31% said it was either, quote, none of the doctor's business, or believe the doctor would disapprove.
We really want to be a neutral party. We want to be Switzerland in this community. Frequently, physicians are referring to physical therapy and rehabilitative services. We just want to be one of those services that a patient can come here and receive a variety of treatments.
You're doing a little bit of each modality with your clients, so it's not just massage. It's Reiki, it's energy work, it's little cranial sacral therapy, and then a little face reflexology that you mix in. And then when I met Carol and the team, it was like we all decided we really wanted to play in each other's sandbox together. And so it was very pulled together, very a beautiful option where we can work with the same clients to help integrate their own health, their health journey.
I do health coaching, which a lot of people think that's a weight loss thing, but it really is an education of healthy eating, healthy lifestyle, making mindful choices, decreasing stress. I use a lot of meditation, stress relief, breath work, teach people how to breathe in order to slow their heart rate down, or give them new tools to really learn how to care for themselves, because in the end, you can go to a doctor, you can go to a nurse, you can go anywhere you want, but you really have to care for yourself. So I teach self-care.
When we come back, a look at a film that explores the shortcomings of America's healthcare system and efficient ways to fix it.
It's a completely irrational system.
Plus, other practitioners talk about their roles in integrative medicine.
I would sort of daydream about how could I combine my two careers. And then I went to a continuing education program on integrative medicine. I had never heard of integrative medicine before.
More after this break. Your extraordinary future begins at Wingate University with more than 35 undergraduate majors and graduate and professional programs in the health sciences, business, and education. Wingate University's enrollment has mushroomed and construction has skyrocketed in the past 2 decades. And Wingate is the 6th best value in the South, according to U.S. News & World Report. Most importantly, Wingate graduates get jobs. They're working all over the Carolinas and the U.S. Major in a great life at Wingate University.
In 2012, a documentary called Escape the Fire, The Fight to Rescue American Healthcare, examined the deficiencies in the healthcare system and explored cost-effective solutions. The film's director and producer, Matthew Heineman, sat down with C-SPAN to discuss how he went about exploring the topic.
In America, we spend $300 billion a year on drugs, and that's almost as much as the rest of the world combined. So we really wanted to try to explore this, and we ended up deciding to explore it through the military.
Well, here you go. This is what he's got left of the morphine.
He was issued this bottle today, 20 in it, and 10 are missing. He's taken 10 tablets.
That's
way,
yeah.
Oh my God, that is ridiculous. That's why he's a little high right now. At some point, he could stop breathing.
What we see in that clip is really sort of what happens when we have a fragmented system. When we have a bunch of different doctors picking at different pieces of us, but not looking out for a whole person. I mean, there's no way a human being should be on as many drugs as he was on that plane. I mean, he almost died on the plane. We ended up following him after this plane ride for many months, as I said, and he ended up entering himself into an innovative program at Walter Reed, where they ended up using acupuncture, using meditation, using other techniques to wean him off of all the drugs that he was on. And through this program, he actually was able to walk out of Walter Reed on his own 2 feet. I mean, that's sort of the whole thesis of the film, really. The metaphor of Escape Fire is that, you know, the status quo isn't working, and we need to start looking for outside-the-box ideas.
Michelle Spurlock, adjunct professor at Wingate University, was also looking for an out-of-the-box idea when she first heard about integrative medicine.
If anything, I think people are taking more medications than they ever have in our history. And I think, and people are honestly getting a little fed up, they're getting a little sick, if I can use that word, of taking so many pills, and people are really looking for other ways to be healthy other than taking pills. For me as a pharmacist, a lot of patients just want to know, well, what pill can I take to make me feel better? You know, give me the pill that's going to take care of my depression. Give me the pill that's going to make me lose weight. And a lot of times that's never the answer. You know, it's you know, maybe there's something that you could take to help, but it's always got to be how you're living your life, the foods that you're putting in your body, the activities that you're engaged in. You know, a pill is almost never the answer. It's usually a very small piece of the answer.
Spurlock says she was able to combine 2 careers, traditional and non-traditional medicine, by becoming part of the Center for the Healing Arts team.
What I do is basically called medication therapy management, and pharmacists that provide this service basically sit down with patients and go over everything that they're taking, and that includes prescription drugs, over-the-counter drugs, herbs, supplements, vitamins, whatever they're taking. So we go through everything that the patient is taking, and we make sure, first of all, do they know why they're taking it? So we do some education. Do you know why you're taking this? How do you take it? A lot of times we find that patients are not taking the medication the way it was prescribed. Maybe it needs to be with food or without food or at bedtime as opposed to in the morning. Maybe it's supposed to be separated from some of the other things that they're taking. Often vitamins need to be separated. So we kind of go through everything that they're taking. And then usually after the patient leaves, I go ahead and do some research on my own. I look for drug interactions, things, you know, medications not working together properly. I investigate. A lot of times, like I mentioned before, sometimes patients are taking something just to treat a side effect of another medication. If we could change that original medication, maybe they wouldn't need that second medication. So that's a lot of what I do, as well as communicating with their primary care physician to say, hey, you know, we might need to try and adjust things a little bit. And some physicians are so grateful to have just someone to have the time to kind of go through, because some of these medication regimens are so complex. So some of them are just so grateful to have somebody else take the time to sit down there and deal with it. And others, you know, are not wanting the input so much.
Coming up after the break, critics of alternative, complementary, and integrative medicine.
Alternative medicine that's been shown to work is called medicine. And there's no alternative to that, that's it. Medicine that works is medicine, there's nothing else.
Health Matters will be right back. What is Wingate? A thriving university nestled in a quiet community near Charlotte. Named 6th best value in the South by U.S. News & World Report. Leading the way in the health sciences with pharmacy, PA studies, and nursing. What is Wingate? Big enough to offer 22 NCAA sports. Small enough to attract the best and brightest in the world. What is Wingate? Wingate is you. Wingate University. Major in a great life.
A simple Google search for hospitals and universities teaching or using integrative medicine turns up dozens and dozens of results across the country. Even with the growing popularity in some places, it's just as easy to find the critics. A recent paper, in fact, by staunch critic David Gorski called for an end to all clinical trials for integrative medicine, saying in part, quote, integrative medicine undermines the scientific basis of medicine by integrating magical thinking and pseudoscience with evidence-based medicine. Gorski was a part of a panel that discussed the topic along with other doctors at a 2012 convention.
There are actually 3 types of medicine. Medicine that has been shown to work, medicine that hasn't been shown to work, and medicine that's been shown not to work. So, and CAM is mostly the latter two, medicine that either hasn't been shown to work or has been shown not to work. And that, you know, the whole term complementary and alternative medicine is basically more of a marketing buzzword than anything else. That you know, back 20, 30 years ago, it used to be called alternative medicine. And over time, they decided that they didn't like, you know, alternative implied that it was inferior, it was outside the mainstream, which of course it was. And so they came up, I don't know who came up with this term, but complementary and alternative, they're like, okay, it will complement medicine. You use it with regular medicine, which leads to Mark Crislip's quote, because the latest buzzword is integrative medicine.
Right, integrating CAM into regular medicine.
Or as I say, integrating quackery with real medicine.
Right.
The former editor of the New England Journal of Medicine said it this way, quote, in the best kind of medical practice, all proposed treatments must be tested objectively. In the end, there will only be treatments that pass the test and those that do not, those that are proven worthwhile and those that are not. Despite these critics, practitioners I spoke with say integrative medicine is for anyone open to try it. They say what they are trying to do is not fringe, but the direction society is heading.
People are reaching a point where, you know, we're living longer as a country, and so chronic illnesses are increasing, and people are just finding that the traditional ways of addressing these issues are not acceptable. And you know, with the healthcare crisis that we're in, and with all the changes that are happening in healthcare, the patient, unfortunately, is probably the last person in mind in all of this. I mean, the fight in Capitol Hill is really between the insurance companies and the hospital systems and the pharmaceuticals and the manufacturers. And so the patient is the last person that really is represented in all this. And unfortunately, because of that, I think the patient will ultimately find that they have to empower themselves to get the type of health care that they need.
That is all the time we have for this episode of Health Matters. I'm Kristen Johnson. Thanks for watching.
We welcome your thoughts on this show and your ideas for future topics. So email Kristen at k.johnson@wingate.edu or follow her on Twitter at kjohnsonwutv.